Cancer research is developing rapidly. What are you excited about when it comes to head and neck cancer research?
Well, I think there's a lot of different clinical trials that are coming out in what we call the neoadjuvant space. So before you go for a surgery. So again, head and neck cancer is a little bit different when we think of other more common cancers. And what I mean by that is, it's one thing to be able to surgically remove cancer or to ablate it completely with radiation. The problem with the head and neck area, as you can imagine, it's such a small area. There's a lot of precious real estate there, as I always describe to patients. And so it's one thing to cure the cancer, to cut it out completely. Then we have functional and sometimes cosmetic concerns after that too. So I think one of the biggest things that we are always trying to look to be successful in is, are there therapies or there treatments where we can shrink down the initial cancer so that the resulting surgery or the fields of radiation are not so severe? So we're maintaining the cure rates that we have or improving on the cure rates that we have, but also thinking about how can we improve the quality of life and the function and the cosmetic outcome, after their cancer treatment. And I think that's really exciting.
It is. It's great. And I'm sure there's been so much development in the field, even in the last 10 years.
Mm-hmm. There has, and to another comment to make on that point too, when we're thinking about clinical trials, especially, there's really two big subsets of squamous cell cancer, head and neck squamous cell carcinoma, and that's HPV positive, that's related to the HPV, the human papilloma virus, and HPV negative. HPV negative is what we think of historically as being caused by years of smoking, often with heavy drinking. That's kind of the traditional head and neck cancer patient. But over the last couple of decades now, there's a completely different disease that we have recognized, and that's related to HPV. And these patients tend to be light or never smokers at all. They tend to be younger, a different demographic of patients. The good news is those cancers seem to respond better to cancer treatment, particularly radiation and chemotherapy based. So, as I mentioned before, trying a neoadjuvant approach to kind of reduce the impact of surgery or the impact of radiation, particularly with HPV related disease, we know that it's a different disease that behaves much better than HPV negative. So trying clinical trials to what we call de-intensify therapy. So maintaining the high cure rate, but reducing the toxicities related to treatment so that, these are younger patients, they're cured of their cancer, but, they still require a feeding tube, or they have a lot of chronic pain in the neck. They have a lot of morbidity with the treatment. And so trying to reduce that down to, again, maintain high cure rates, but help with quality of life in the years to come.
Mm-hmm. How can patients stay up to date on developing research?
That's a really good question. I mean, every once in a while there are sound bites or news articles that are, kind of in the mainstream press and in the mainstream news. I would just encourage patients to, if they read something or see a headline, to reach out to their oncology team and have a discussion. What is this research? What does it mean for me? Does it apply to me? How is this information being used for cancer treatment? How would this impact my treatment or my follow-up? It's really hard to kind of navigate through what is, in terms of research, what is immediately clinically impactful or clinically meaningful at that time.
Are there any websites that you recommend to patients?
The American Head and Neck Society has a good website, and there's a couple of other, depending on what state you live in, or regions of certain states, there's a lot of different support groups for head and neck cancer patients that I would encourage patients to reach out, because especially in the regional, geographic location where you are, it may be worthwhile to be able to have those conversations, because, you can walk down the street and not know if somebody's had it, but I've had more patients over the last several months, especially HPV related disease patients, who have mentioned something to me along the lines of, I had mentioned to, an acquaintance or a friend of a friend, and suddenly I know 3 or 4 other people who have had this cancer, and I had no idea. And, now we're talking about how we, have to carry a water bottle with us all the time because we can't swallow, dry foods, and how we have to be very mindful of what we're eating when we order at a restaurant. And so just trying to navigate a bigger world, narrowing it down to where you live, to have those meaningful contacts of other patients who have gone through what you've gone through.